Hey, it's Dr. Brahmbhatt here, coming to you from Studio B, and today we're going to talk about Pinktober. Now, most people think that Pinktober is all about women because breast cancer only happens in women. Not true. Believe it or not, 1% of all breast cancers are actually diagnosed in men. 1 out of 100 breast cancers will be found in men. In 2021, it's estimated over 2,600 men will actually be diagnosed with breast cancer, and out of those, over 500 will actually die from the disease. Men, guys, you can get breast cancer. The problem is, though, is number one, men feel like, I'm not going to get breast cancer, I haven't got breasts. Well, the truth of the matter is that you, as a guy, definitely have breast tissue. That breast tissue can become cancerous. Now, it's extremely rare, but it can. And this is why it's very important, number one, for men and their significant others to know that a guy can get breast cancer. But most importantly, number two, which really should be number one, is if you feel any abnormal lumps, abnormalities, discharge, pain in this area, go and get checked. The problem with breast cancer in men is, yes, it's rare, but in men, when it's usually diagnosed, it's usually a little bit more advanced because the dudes waited a little bit too long. So it's extremely important to recognize that this disease can happen to you as a guy. You are not immune from it. And when you do have an issue, go and get yourself checked. Now, not every lump or bump in this area is a cancer. Actually, one of the most common reasons men may have an enlargement of their chest or their breast tissue here is something called gynecomastia. That's actually a benign condition. But what's not benign is lumps or bumps or discharges or painful areas or areas that may drain. You got to get yourself checked out for breast cancer. Now, how does a guy get checked for breast cancer? Well, it's pretty much the same test that women go through. But men do not have a screening protocol. So it's not like at a certain age or based on your family history or whatnot that you're going to get hyper screened. No, it's so rare that it's one of those things where when it happens, that's when you kind of see somebody. But there are certain risk factors that you should know about. If you're over the age of 40, if you're overweight, if you have a family history of breast cancer, and if you have a certain genetic predisposition. There's certain genes that make you more prone to breast cancer. And what's really interesting for me as a urologist is that men that have prostate cancer, if we do genetic testing on them, on some of them, we've actually found that there is a certain syndrome or certain cluster of cancers that can happen with men that have prostate cancer. And those actually include breast cancer. So now what I've changed in my office is when I diagnose a young guy, or any guy, this option for anyone, a man with prostate cancer, I'm going to offer him some kind of genetic screening for him and his family. But regardless, the treatments, everything else, that's a story for another day. I really want to just let everyone know that breast cancer can happen in both genders. Please support the movement. Let's raise money for women and men when it comes to breast cancer awareness, breast cancer prevention strategies, and essentially treatments for this disease as well. So it's late night here, and I'm going to go to sleep. So thank you. And this is Dr. Brahmbhatt again from Studio B. Good night and be well.